coming at you for a very special Tuesday afternoon Facebook Live. I'm here with Dr. Aybar from the Annapolis Pediatric Gastroenterology. Am I saying that right?
Correct,
and Nutrition. They are a sponsor for the Preschool and Child Care Fair happening on Saturday the 26th. And as you know, I just love coming out into the community and getting a chance to talk with the movers and the shakers and people who are out in the community doing well, especially for the children.
Mm-hmm.
And so myself, I'm interested. Tell me a little bit about your practice, please. I would love to know about why you feel it's important to be in the community and be a part of coming to the preschool child care fair. So let's start with a little bit about your practice.
Right.
Who comes here and why?
So I started, working in Annapolis in 2011 after I was, finished with my training. And pediatric gastroenterology basically covers newborns to 21-year-old, basically, and it's a number of gastrointestinal problems, from reflux to colicky behavior to formula problems to celiac disease, feeding disorders, and then more kind of significant problems, especially in older kids, such as Crohn's disease, colitis, and kind of the spectrum of things. And what we do is when usually I get refers from the pediatricians because I've been in the community for a long time, so they know me and they know what I do. So I get refers from them, and sometimes people, like Google, and I ask them because I have some patients coming from like Frederick or, Southern Maryland or even Delaware, shore. So I ask them how they find me, and they say we Google it and we see, what your ratings are, and then we come over. So, anyways, they come over, they get evaluation, and then if they need labs, they get those based on those, and medications if they respond to it and not respond to it. And sometimes they have to get endoscopy or colonoscopy, which is a little bit more invasive, but certain diseases require that for diagnosis purposes and follow-up. So I try to provide that service to them. And I guess the benefit to the community is I see patients here, I admit them to our community hospital, and they don't have to go anywhere else for that, like Baltimore or Washington, D.C. So it's all done here, and we have close contact with them. We follow up, their lab with us, and questions or concerns.
That's great. And so do you work hand in hand with the pediatricians? You said that you get recommendations. So
and
if
also
my child,
hospital,
if I was concerned and the pediatrician shared those concerns as well, would refer, and then would be a team effort on fixing whatever the issue was.
Also, a lot of times people go to emergency rooms for an acute illness, and the emergency room doctors, the pediatric doctors there, they also refer patients over because they feel like they need follow-up. So that would be, another appropriate way of doing that.
Wonderful.
And the reason about the Saturday event is that I just wanted to, meet with more people basically, and let them know what's going on here, because there may still be some people that do not know like what to do or where to go. So meeting them face to face and them seeing me, and being a part of the community is always a good plan.
I agree, especially because we are focusing on preschool and childcare, obviously at the preschool childcare fair, and so we are we're trying to really reach those new parents, or they may be expecting their first child, or they have a small toddler and a baby, and I know on a lot of the moms groups that I see on Facebook, acid reflux is a big concern for babies, because you really don't they can't talk, you don't know if they're getting the nutrition, and to have the expertise, and so
and breastfeeding or certain formulas, there's always a question about a concern, especially as you mentioned, young moms and young parents that do not have that much experience. So try to help them out also.
Wonderful. Well, we can't thank you enough. We're the preschool child care fair. We're just very excited about it because it seems it's going to be so robust. We have medical professionals. We're going to have a little bit of CPR training. We are going to have some enrichment. So there's going to be an animal that the kids can interact with some animals. There's going to be games and activities and crafts, and it's just going to be, I think it's going to be a really, really great event, and just an amazing resource. And so I just so appreciate everybody taking time out of their busy schedules to just become part of it. So, Dr. Aybar, we cannot thank you enough.
You, and I thank you for the opportunity also.
Oh, yes, it was just a pleasure to speak with you, and I look forward to seeing you on Saturday, and I hope to see everybody on Saturday as well. It's at the Westfield Annapolis Mall. It starts at 10 a.m. and goes through 2 p.m., so please be sure to stop by and check us out and say hi. Thanks.
Right.
Bye.
Bye-bye.